Hello everyone, I am Dr. Sweta Agarwal. I am a fertility specialist and gynecologist at Southern Gem Hospital in Hyderabad. First of all, at the outset, I would like to congratulate each and every one on the occasion of 43rd World IVF Day, which marks the birth of Louise Brown, the first IVF baby. Talking about fertility treatments and IVF, I had the passion in this area right from my early days of medical school. I always desired to become a fertility consultant. So soon after completing my post-graduation in obstetrics and gynecology, I had been to Australia, which is one of the best places in the world to get trained in the fertility segment. So I have worked with Melbourne IVF. That's where I was trained in this area of fertility treatments, where we got immense experience, and I've seen a large number of people going through these fertility treatments. My journey with IVF starts from 2007. That's when I had my first IVF baby delivered there in Melbourne IVF. And further, I went along and I was trained even in Western Australia under the guidance of Dr. John Yovich, who had given the first IVF baby to Western Australia. Since 1978, the areas of fertility treatment have looked at lots and lots of advancement, and the success of fertility treatment has been immensely increasing with time. I came back from Australia in 2012, and since then we've been working in Hyderabad through two fertility centers, one in Bashirbagh and one in Banjara Hills. We've got one of the best IVF centers in the country. And talking about the fertility treatments, the heart of any fertility center is the lab, and we've got one of the best labs, which is a class 1000 lab, which is going to give one of the best possible fertility results to our patients. And when coming to fertility treatments, I would like to say that not all patients who come to a fertility center would need IVF. 80% of our patients can get pregnant with simple treatments like timed relationship or IUI, which are very simple treatments, does not involve much of cost or much of treatment to the patient, and very handful of patients would need IVF treatment or test tube baby treatment. These are also fairly simple treatment from the patient point of view, where we take an egg from the mother, a sperm from the man, and make an embryo or the baby in the lab, and then put it back into the womb of the mother. So these are very simple treatments. The success of fertility treatments with IVF is also very good, and sometimes we see there is a myth about people ask me that do the babies born out of these fertility treatments, any sort of fertility treatments, do they behave like normal babies? Then my answer to this question is the babies which are born out of these treatments, they are absolutely normal as the children who are born out of natural conception. So I would encourage all the people out there who are looking at fertility treatments, come out of their social taboos and break the barriers. Come forward. There are lots of fertility doctors around us. Approach them, talk about your problems, get yourself investigated, find out what is your underlying cause of the infertility, and then we can go for the right treatment which is more appropriate according to your problem, because we've got a large number of treatment options available. IVF is not the only treatment. So according to your problem, we can choose the treatment which is more suitable for you. And even with IVF also, beyond that, even if your IVF is going to fail, people sometimes get worried, they get depressed that I have been through a cycle of IVF and my cycle has failed. There are lots of treatment, there are lots of other things what we can do for you even if your IVF fails, because not everyone is going to get pregnant with the first cycle of IVF. Sometimes we need to evaluate that why did your IVF fail, and then look at the other treatment options which we can add in your IVF programs to give you a better chance of pregnancy next time. So I would encourage each and every one of the couple out there to come forward, get yourself evaluated, and take the best advantage of the fertility treatments which are available today.
If you know of any couple who are unable to conceive within 12 months of trying, please encourage them to seek help from medical experts. Let the reach of scientific advances in reproductive health spread to all corners of the country and bring joy to all such couples. This public awareness message aimed at spreading awareness on infertility and its treatment is brought to you by Novelty Health Shine.